So RESILIA is derived from the word resilient. Okay, and what RESILIA technology is, it is a bovine pericardium which has been treated with a very proprietary anti-calcification technology. So as you can imagine, the bioprosthetic valves, they undergo degeneration or deterioration, which is the same as a natural valve would go through. And what that translates into is that once the valve has been implanted, over a period of time, because of wear and tear, it will undergo calcification, just the way a natural aortic or mitral valve would. So the proprietary technology that we have, it actually prevents the calcification over a period of time. And this is unique to Edwards. No other company has this. Okay, so that is the reason why we call it RESILIA. It is resilient to wear and tear. It is resilient to anti-calcification. Yeah, so the RESILIA technology is used for a variety of surgical valves. So it is used for the aortic valve. It is used for the mitral valve. It is also used for the transcatheter aortic valve. So as you know, you can undergo a surgical replacement where we use our surgical valves, and then you also have the transcatheter or TAVR valves, which is called as Sapien 3 Ultra RESILIA. So there we are using the same technology, but the valve is implanted transcatheter, which is through TAVI. So if you look at the RESILIA valves, a lot of them are being used across the Asia-Pacific region. So a lot of it is used in Australia. We've recently launched this in India. It will be launched very soon in South Korea. So South Korea, the TAVR RESILIA tissue is going to be launched. And of course, we already have the surgical valves which are being used. And all across, even in Singapore, Malaysia, all the regions, we do have the RESILIA valves which are being used. Now, why the surgeons are preferring the RESILIA valves over the other valves is precisely because now we are looking at the lifetime management of patients. When you have a patient who comes with aortic stenosis or even mitral stenosis, where they require some kind of procedure, if you're using a bioprosthetic valve, it will last for about 10 to 15 years. Okay, and now with the Cummins 10-year data, we for sure know that at 10 years, there is freedom from structural valve deterioration or SVD, which is almost 98%. So the surgeons can, with confidence, now implant a RESILIA valve, and once it deteriorates, so probably after 15 years, they have a chance for undergoing a reintervention using the transcatheter approach. So that is what we call as lifetime management of the patient. And the whole Cummins 10-year data, the whole durability has an impact on the choice of first valve and also the reintervention. So that is the reason why a lot of surgeons and physicians are now preferring the RESILIA technology, because with confidence, they can actually tell the patient that we can take care of you for the first procedure and even for the second procedure, what we call as lifetime management. We are in the era of clinical, data or evidence-based medicine. Evidence is important. We cannot, really discount that. What we are also doing is we have a government affairs and market access team, which is kind of creating this economic model where we are emphasizing to the different governments or the reimbursement organizations, saying, if you look at the economic cost, if you're using something which is durable, which means you have lesser reinterventions, it has an impact on the amount of resources which are needed already in a resource-constrained market. So again, we do have our teams who are working closely with these organizations in each market. And again, the reimbursement in every market across APAC is so different and it is so diverse. So it's definitely not one size which fits all. We are taking a customized approach and ensuring that maximum patients get access to our therapies. And it is not something which happens in a few months. Sometimes it takes years to get that approval for reimbursement done. before the Commence 10-year trial results came out, obviously we used to always be pushed back on, oh, we need more data. So now that we have already got the 10-year outcomes, with confidence, we can tell the patients that you'll have freedom from structural heart deterioration, which is 97.9, freedom from reoperation due to SVD, which is 97.8. And obviously, these outcomes are definitely shifting the paradigm. So, when we have spoken to surgeons, even like a couple of weeks ago in India, we found that the surgeons, based on this data, are already considering, how this is going to shift the treatment pathway for younger patients. So it is going to give them more confidence with the Commence 10-year trial. And again, we do not know if we'll be following it up all the way for another 5 years. But again, it is something which will keep evolving and something which we'll keep sharing with the surgeons and the physicians to give them the confidence to treat these patients throughout their lifetime.